Hello, I'm Nick, the nurse. Today we're going to be talking in a mental health nursing setting. When we think of restraints, I think most of us, whether we're nurses, nursing students, or just members of the general population without a lot of medical or nursing knowledge, I think some of the things that automatically come to mind are leather restraints or wrist restraints or maybe even a posy belt. But in reality, there's a lot of other different types of restraints that exist in the mental health and nursing profession. One of those types of restraints are chemical restraints. Are chemical restraints sometimes necessary to help our patients protect themselves against themselves and protect other people from the patient? Yes. But it's important that we understand the nature of chemical restraints. Some chemical restraints, the two big ones that you see a lot in both nursing home settings and in acute care facilities are Haldol and Ativan. Now, Haldol, Paradol, or lorazepam, which is Ativan, is often used to chemically restrain patients or sedate them or to help alleviate their anxiety or to help contribute psychoses. And they have a lot of good positive effects long term. However, one thing that you have to remember when utilizing chemical restraints to include antipsychotics and benzodiazepines like Ativan is that you need to make sure that you know the side effects, because a lot of times, even though they can have some good use, there also are a lot of side effects. What are those side effects? Well, the number one thing with Haldol and with Ativan is, of course, sedation. And in some cases, the sedation can actually be so bad, in the case of perhaps a nurse overdose, that the patient's respiratory system or central nervous system can actually shut down and the patient can die, which is an unfortunate and horrible thing. Because not only would the poor patient lose their life, but the nurse would lose their license and expose the hospital to liability. So there's a lot of things that you have to understand, including the side effects of these medications. Other side effects, for example, in Haldol can include weight gain. In Ativan, it can include respiratory depression. So you need to be cognizant of the different side effects associated with different types of chemical restraints and antipsychotics and benzodiazepines. So these are very important things that you should know not only for your nursing school exam, eventually become a nurse. And when you are titrating these medications, because a lot of times they are PRN, especially with Ativan drips or with Haldol PO, or injection or the injectable form, what have you, you want to make sure that you give enough to give therapeutic benefit to the patient without sedating them to the extent that it's going to make them out of it and a zombie and perhaps cause them to have some type of bodily system depression. So these are things that we need to look at. Thank you for watching our video today, and I'm Nick the nurse, and we'll see you next time.